Have you ever wondered why some wounds heal perfectly while others take a long time? The secret may be in the dressing. Today we're talking about passive dressings. I'm going to teach you about each of them and the indications, the contraindications, and some unique applications for each of those types of dressings. Let's go. Welcome back to Citizen Surgeon. My name's Dr. Eric Pearson, and we're continuing the conversation on wound healing. We've done talks on Wound Healing 101, all the phases of healing, the cells involved. We've done talks on wound dressings. We've done talks on the wound environment and what keeps wounds from healing perfectly. And today we're going to go deeper into the dressing series by talking about passive dressings. And first, to do that, we got to define what a passive dressing is. So what is a passive dressing? A passive dressing is a dressing that provides protection from the environment and support for wound healing, but does not interact with the wound bed. So for example, some dressings, and we're going to talk about in those future videos, or you can check out my video here about how dressings work. And that's going to give you a brief overview of all the dressings, but there are some dressings that deliver medication. So for example, an antibiotic or silver. There are some dressings like foam dressings that are really good at absorbing exudate. There are some dressings like hydrogel dressings that are hydrophilic and add moisture to the wound. But today we're talking about passive and supportive dressings. So they provide protection and a physical barrier to the environment, but they don't interact with the wound as far as moisture balance, medication administration, or debridement. All right, so let's get into these. I got a few of them right here, but there are 4 major types of passive dressings that we need to talk about. So we have gauze. All right, so this is usually in a roll, and gauze is going to be a great supportive dressing. It also has some unique applications. We're going to talk about transparent film dressing. So Tegaderm right there, I use it almost every day. Now, Tegaderm is an interesting dressing that has a ton of benefits. We're also going to talk about petroleum gauze, so petroleum dressings that can really help moisturize a wound, also protect it. And then finally, we're going to talk about non-adherent dressings like this one that are non-adherent and also have some really good applications, especially with fragile tissue and children and the elderly who have very delicate tissue. So we're going to go through each of these, and let's start with gauze. So the simplest application of gauze would be for general wound care. So minor scrapes, minor abrasions, even small surgical incisions. Either a 4x4 gauze or a roll of something like this, Kerlix, is going to allow us to provide a protective barrier to the environment for that wound. Well, a second application for gauze can be with packing deep wounds. So let's say that you have a large necrotic wound on an extremity, or if you have a deep wound in the chest, we may want to pack that wound with gauze, all right? And one trick that I would tell you is if your wound takes more than one roll of gauze, one rule in surgery is that we never pack multiple dressings into a wound as separate dressings because you can lose them. So if we're going to do a deep packing, let's say we have this roll of Kerlix right here, and we have this one right here, and we're going to pack this wound. What do? Well, we get the 2 ends, and then we tie them together, okay? Because if we tie them together, then we're not going to lose any gauze or any dressing into a wound, and then you got a foreign body, and that wound is certainly not going to heal. So if you ever have to pack a deep wound and you're using more than one dressing, you want to make sure you tie those together. Well, what are some other uses for gauze? Well, it can be supportive as a secondary dressing. So for example, we're going to talk about petroleum dressings. Let's say I have a partial thickness burn, or I have a superficial abrasion, or I have a surgical wound and I lay a petroleum gauze over that wound. Well, I can support it with a 4x4 dressing or a roll of Kerlix gently around an extremity, and then usually I'll secure that with something like this, which is an ACE wrap. Okay, so often I'll go a primary dressing followed by gauze and then an ACE wrap, which will finish the dressing completely. Another type of dressing that I'll use to finish off a wound, if let's say I have a couple of 2x2 dressings or 4x4 dressings, is using Coban. So Coban is an elastic type dressing. It's self-adhesive, so you don't need tape. And I think this is excellent, especially if you have a small finger wound or something on an extremity. Coban is really good to finish that dressing off. So what's another use of gauze? Well, we can also use it for superficial injuries like partial thickness burns or abrasions. But if I'm going to be using gauze for a superficial wound, I usually just don't want to use it alone. Sometimes I'll add a hydrogel, something like this, to the wound, or I'll add some ointment to the wound that's going to help keep it moist, because one of the downsides of using gauze is that it dries out, and then when you remove it, it can traumatize the wound. Now, is there any situation where we would like that? Well, think about this last point. So we can also use gauze for debridement. So wet to dry dressings, what does that mean? If we have an infected wound, let's say I have a surgical site infection, I have purulent material that I've drained from the wound, and now I want to promote healing. Well, I'm going to do a wet to dry dressing. I'm going to maybe use gauze either as a 4x4, or if it's a larger wound, I might need to use a roll of gauze. And I'm going to get this moistened with water. I'm going to wring it out and then place it in the wound, and then change that twice a day. And when I remove that gauze, I'm going to mechanically debride the wound and remove any dead tissue from that wound to help it heal. So that is one example where when the gauze dries out, it can be good. That's usually only in infected wounds that we need some mechanical debridement. So these are the major indications for using a simple passive dressing like gauze. We have some general wound care, packing deep cavities as a supportive dressing for partial thickness burns or superficial injuries combined with a hydrogel or an ointment, and then finally, if we are going to do a wet to dry debridement. Well, what are the contraindications for using gauze? Well, gauze doesn't have much absorptive capacity. So if we do have a very heavy exudative wound, it's leaking a ton of fluid, gauze is going to be inappropriate. In that case, we might use a foam dressing, something like this, and I'll give that some more respect in the next video where I talk specifically about foam dressings. We also don't want to use gauze for a long period of time. You don't want to leave gauze on for 2 or 3 days because it's going to dry out, and when we remove it, it's going to traumatize that wound bed. Along that line, in granulating wounds that are granulating in, gauze can stick to that healing tissue and traumatize the wound bed. So if we have an open granulating wound, just regular gauze might not be the best choice. You might want something like a collagen scaffold dressing. We'll talk about those again in a future video. And infected wounds. And I put this on here because if we have an infected wound, we might want to use gauze for some wet to dry dressings and mechanical debridement, but we don't want to just cover that wound with a gauze and think that it's going to give us any help with wound healing outside of the debridement. So if we're just covering an infected wound with a 4x4, that's probably not the right choice. Okay, so there's better dressings for that, or we might need to wash out that wound and find out why indeed it is infected. Well, what are some unique applications of gauze? Well, one would be impregnated gauze. So if we want to soak it with Dakin solution, or if we want to soak it with betadine, or even if we want to soak it with Manuka honey, all right, it can be an antimicrobial dressing for us in complicated wounds. Like I said, if we have a superficial partial thickness burn and we want to use gauze, we may want to soak it with a hydrogel, and I showed you what that looks like. If we're in a resource limited area and we have an exudating wound that may benefit from negative pressure wound therapy, and we don't have access to a vac and the foam sponges, as those can be quite complicated and expensive, we can use gauze to pack that wound, cover it with a cling film or ioband, and then use some suction tubing and perhaps a syringe or portable suction to create that negative pressure. If you want to see me do a kind of a DIY negative pressure wound therapy dressing, I can put a video like that together. Just say yes in the comments. Wound can be used in a compression dressing in addition to perhaps an ACE wrap on an extremity. And then of course, if we're gonna pad a splint, gauze can be pretty nice, especially against pressure points like joints and that, if we do have those in a splint. And then finally, talking about splinting, you know, you can use this to secure a splint if we have a SAM splint, or if we're out in doing wilderness medicine and we need to secure something. Of course, a roll of gauze really does come in handy. So a lot of unique applications to gauze. Well, what's next? Well, next, let's talk about transparent film dressings. So transparent film dressings like Tegaderm right here are something that I use all of the time. Now, why do I use these and how is this different from just cling film? So transparent film dressings like Tegaderm or bioocclusive are polyurethane sheets that have an adhesive layer and are semi-permeable. So they're permeable to oxygen, they're permeable to water, but they are impermeable to bacteria and also foreign bodies. So they protect the wound while allowing it to breathe. They also provide a window into the wound so you can actually observe the wound healing process. So what are the indications, or what types of wounds are great for transparent film dressings? And again, because they're not actively or interacting with the wound, these are still considered a passive dressing. So superficial wounds, minor abrasions, minor scrapes, sutured closures. Second would be catheter protection. So after almost every IV that's placed, a Tegaderm or bioocclusive type transparent film dressing can secure that IV catheter and also give us a window in so we can see what's going on at that insertion point between the IV catheter and the skin. It can also be used as a secondary dressing. So often I'll take a Telfa or a non-adherent dressing, I'll put that over a wound followed by a Tegaderm on top, and that provides excellent closure. Surgical incisions, like I talked about, if I do a running primary closure, often I'll place a Tegaderm dressing over that, as it'll last for a few days, provide nice protection to that wound, and come off quite easily. And then finally, thinking about friction. So if we have patients that are at risk of any pressure injuries or friction injuries over the elbow or other joints, placing a Tegaderm over that area can help protect it from those friction injuries. And I'm going to talk about that a little bit in the unique applications of this and perhaps marathon running or endurance events. But first, let's talk about the contraindications to film dressings. Well, number one is the most obvious. So heavily exudating wounds. While they're going to allow oxygen and water vapor to permeate through the dressing, if you have a wound that's really pouring out, this is not the most appropriate dressing. We would want something like a foam dressing, or perhaps we needed negative pressure wound therapy or something else to collect that exudate. Second would be an infected wound. So we don't want to use a transparent film dressing over an infected wound. That is not the most appropriate dressing. Third is in fragile skin. So if I have neonates, okay, or in the elderly who have really thin fragile skin, I don't use Tegaderm, because even though that adhesive is very light, it still is too much and can produce an injury when you're removing that from the epidermis in some patients with fragile skin. And then finally, this might be obvious, but we don't want to use a transparent film dressing in full thickness burns. That requires a totally different treatment paradigm. Okay, so let's get to those unique applications of transparent film dressings. Well, I mentioned friction. Well, if you're a marathon runner, sometimes one of the tricks is to put a Band-Aid over your nipples so you don't get that abrasion over a race. Okay, well, you can also put a small Tegaderm over your nipples, and that might help. So who knew we were going to talk about nipples today, but we are, as a unique application to transparent film dressings. As I said, they can be great for wound observation. So if we have a wound, like an abrasion, a donor site that we're watching, we can put a large bioocclusive over that, and we're protecting it, but we're also able to observe it. Another application would be as a sterile occlusive dressing. So if we have a sucking chest wound and we want to create a three-way dressing, we could do that with a bioocclusive. It's going to allow air to escape but not allow air to enter. So that is another unique application. Finally, if we got tattoos, we can use Tegaderm to protect that tattoo. So if you see somebody with a new tattoo, they have a transparent film dressing over it, they're protecting that tattoo while also having that semi-permeable membrane to allow it to heal and breathe. And then finally, as a waterproof secondary dressing. So if I have a wound that I want to keep out of water, I can place a primary dressing over that wound and then cover it with a bioocclusive or a Tegaderm transparent film dressing, and that's going to allow that patient to shower and protect the wound. All right, next let's move to petroleum gauze. So this is another passive dressing that provides protection from the environment but doesn't interact with the wound bed. So what is this stuff? Well, it's been used since the 19th century, and petroleum jelly is created from fossil fuels. It's triple distilled to remove any impurities, and it's sterile, so perfectly safe for a wound. People can have allergies to petroleum, so you certainly don't want to use this in someone with an allergy to that. However, it is highly purified, it's non-reactive, it's biocompatible and chemically stable and good for wound healing. So how are you going to see this? Well, you might see this as just petroleum gauze, okay? You might also see it called adaptic, all right? And you may also see it called xeroform, where it is impregnated for antibiotic protection. And so if we want to take a look at petroleum gauze, this is just petroleum gauze right here. And we can see when we open it up, it's just basically gauze that is soaked with Vaseline. Okay, and this provides a nice protective barrier and also helps keep that wound moisturized. You do realize that you get your hands all kind of gross after you use petroleum gauze, so be sure to wash your hands before doing any wound care, perhaps wearing gloves so you don't get them like this, or washing them after, and I'm gonna go do that right now. All right, so back from a quick hand wash, let's talk about the indications for petroleum gauze. So one is partial thickness burns. So first degree, second degree burns, and second degree would be burns with a blister development. Okay, so petroleum gauze is non-adherent, going to provide moisture and good healing for those type of wounds. Speaking of burns, it's good for skin grafts to keep them in a moist environment, and for donor sites for split thickness skin grafts, a petroleum gauze on those wounds can help promote moisture in that wound. It's also non-adherent and going to be excellent for wound healing. Third is sutured wounds. So if I have a nice closure and I want to put a gauze over that to help with moisture balance in that wound bed, I'm not going to have too much exudate from that wound, then I'll do some gauze over that and then put a supportive dressing over the petroleum gauze to keep that wound protected. If we have chronic wounds or fragile tissue, a petroleum gauze can be good because it's going to be non-adherent. So when we do dressing changes, we're going to be able to protect that fragile skin. Also in granulating wounds, adaptic over that wound bed or a petroleum gauze can be very helpful and also protect that angiogenesis, the formation of those blood vessels. That's all going to be protected with a non-adherent dressing that also promotes moisture like petroleum gauze. What would be the contraindications for using petroleum gauze? Well, first one's obvious, heavily exudating wounds. So what are some examples of heavily exudating wounds? So think of large venous ulcers. They can have a lot of that proteinaceous fluid, a lot of exudate coming out of them. Infected wounds typically have a lot of exudate, and they are not good in either a gauze dressing, unless you're doing a wet to dry dressing, or here in a petroleum gauze. We certainly don't want to put that in an infected wound. Some burns can have a significant amount of exudate, especially when they're deeper. Dehisced surgical wounds, so if we have a laparotomy wound that is now dehisced, That might have too much exudate as there's a lot of soft tissue. We may not want to use a petroleum gauze in that scenario. Traumatic injuries, so deep tissue wounds, crush injuries, we can have exposed muscle, exposed adipose tissue or tendons, and those can be highly exudative. Pressure ulcers, they can often involve muscle, adipose tissue, and bone exposed. Those are definitely highly exudative. Diabetic foot ulcers can also have a lot of exudate. And then finally, if we have lymphorrhea or a significant amount of lymph from a tissue, perhaps after a fempot bypass, we have a lymphatic leak or something from that femoral wound, that would also be highly exudated. So those are some examples of highly exudative wounds, and we want certainly specialized dressings for those, and petroleum gauze is not the best dressing in that scenario. Infected wounds, again, we don't want to use petroleum gauze in infected wounds. If we have deep cavity wounds, we don't want petroleum gauze in there. Very good for superficial, not good for deep wounds. And then again, of course, if there's an allergy to petroleum products, we don't want to use a petroleum jelly impregnated dressing because that's going to cause an allergy. All right, so now let's get into the last one, and this is fairly straightforward. These are non-adherent dressings. So an example of this would be Telfa, okay, that would be a brand name. But non-adherent dressings, basically think of these as the inside of a Band-Aid. You know that little white square? Well, that is a non-adherent dressing. So what are the indications for that? Post-surgical wounds, post-closure, these can be excellent. Partial thickness wounds, abrasions, skin tears, and of course any chronic wounds on very fragile tissue. Non-adherent dressings, sometimes under a tegaderm or under a primary dressing, can be fantastic. If I have an elderly person that has very thin skin, I'll use a non-adherent dressing, and then instead of putting a tegaderm on it, because I might injure that skin removing the tegaderm, if I don't want to use tape, I'll just put the non-adherent dressing followed by some Curlex in an ACE wrap, and then I have no adhesive at all on that fragile skin. Again, the contraindications, heavily exudative wounds. So you see, this is basically, you don't want to use any type of passive dressing in a heavily exudative wound. We also don't want to use this for infected wounds, any deep cavity wounds, or burns that have significant exudate. So these were the passive dressings. So we got gauze, we can get that in 2x2s, 4x4s, rolls of gauze, and we know the indications and when not to use it. We have transparent film dressings like Tegaderm or Bio-Occlusive. They can be fantastic, but if we have a heavily exudative wound, not such a great dressing. We talked about the indications for petroleum impregnated dressings, and of course we talked about non-adherent dressings like Telfa, or just think of the inside square on a Band-Aid. If you want me to dive deeper into any one of those products, definitely let me know in the comments. I'm going to put a link to some of those products in the description below so you can see which ones I prefer, okay? And they're very easily to get, and you should have them in your basic go bag or your home first aid kit. If you enjoyed this and there's other questions you have on wound dressings, leave a comment and a question below. Share this with somebody you may think has a need for this type of information. And if you're new to wound healing and you want a nice overview, check out my Wound Healing 101 video. All right, that talks about everything wound healing. Also, check out my video on dressings where I go over all the types of dressings, both passive and active. All right, as always, study hard, work hard, dream big. That's a new one. I'll see you next time.